my name is Frances Milligan. I'm the program director at Lido Wellness Center, and I am responsible for conducting all of the pre-admission intakes and screenings prior to somebody joining our program. And I want to talk a little bit about what our admissions process looks like and shed some light into what to expect in that process. So the initial contact is a phone call or email to Colin Whedon, who is our admissions director, and during that initial contact, the person, whomever it is that's calling, is able to gather a lot of the basic information regarding our program. So information like what our program day consists of, what some of the financial responsibilities may be, what are some of our specialties and areas or diagnoses that we treat. And after that step's completed, then if the person's continued to be interested, then they would be passed on to myself, and in my role as a licensed marriage and family therapist, I conduct, like I mentioned, the pre-admission screenings. And so that typically is about a 20 to 30 minute conversation, and really what I'm looking for is just gathering some basic information about whatever the individual is struggling with. So oftentimes there's questions and dialogue related to depression or anxiety, or potentially bipolar or PTSD, or any other kind of related issues that someone might be struggling with. And during that call, really what I'm trying to do is figure out whether or not we'd be a good fit to work with the individual, and whether or not we treat what that person is struggling with. It's really kind of an open conversation, and it's a time to ask further questions if that's something that might come up, and really just to see whether or not we'd be a good fit. At Lido Wellness Center, we really value individualized care, and it really starts at intake.